This segment sponsored by Foster Financial. Welcome back to Women's Wealth Wednesday, and I'm so thrilled to have Foster Financial here to give us some really great financial advice specifically for women. And joining me today is their Vice President, Caleb Doan. Hi.
Hi.
How's it going?
It's going well. How are you doing?
Good. Okay, so last Women's Wealth Wednesday, we started talking about the Indiana public retirement system?
Yeah.
Okay,
yeah.
and that was such good information, so we have to continue the conversation.
Yeah, absolutely. So Fort Wayne Community Schools is a big kind of participant in the Indiana public retirement system, and there's probably a lot of teachers now off on break for the summer, so figured it'd be a great time to chat about that. I know last week we talked a little bit about the pension and some of the payout strategies that people can choose with that. And this week I thought we'd talk a little bit about the kind of health insurance, health benefit side of things.
Okay.
So I think when people retire prior to 65, which can be somewhat common with teachers, because a lot of times they might have a pension, and so if they've worked as a teacher for 25, 30 years, they have that stream of income and they can live on that until they hit 65. Maybe they turn on Social Security later on. But one of the biggest things they don't have when they retire is you can't turn on Medicare until you're 65, right? So if somebody retires at 62, they lose health insurance from their work, but they can't turn on Medicare for a couple years.
What do they do?
Yeah, you have to plan for that,
question,
2 or 3 year gap. Just paying completely out of pocket can be pretty expensive. But within the Indiana public retirement system, there's a couple benefits that can kind of help bridge that gap for a few years. So one of the accounts that we've talked about before is HSAs, health savings accounts. Those people can contribute to while they're working, and then you can use that for out-of-pocket medical expenses. One of the ones that we haven't talked about before that is inside of INPRS, Indiana Public Retirement System, is an HRA. And so this stands for Health Reimbursement Arrangement, and it's in some of the plans, not necessarily in all of the plans, but it's similar to an HSA, except only the employer contributes to it. And so they contribute, they make contributions into the plan for the employee. When the employee retires, they can use that account to help pay for Medicare or medical health insurance premiums until they hit Medicare age, and then they can go on Medicare.
Wow. Well, first off, Caleb, we love it when you introduce new terms to us.
So that's so amazing, many acronyms, right?
HRA, that's so cool that the public retirement system offers that. So tell me a little bit more detail about it. Like, how much is the company contributing, and is there an expiration on the funds that are being used? Yeah,
that's a good question. So it kind of depends on every individual employee, what sort of plan they're in and all of that, with how much the employer contributes.
Right.
But it's not uncommon for retirees, if they've been at the school for a really long time, maybe they have $15,000, $20,000 inside of an HRA. And a lot of times to pay out of pocket for the health insurance when somebody retires prior to 65, it could very feasibly be $500, $600, $700, $800 a month for that health insurance.
Right.
And so you can kind of get on a plan with the HRA, you pay out of pocket for it, the HRA reimburses you every single month until the funds run out there.
So does this account reimburse you for the premium for the health insurance and what you have to pay as far as deductibles and out-of-pocket costs that you typically would at your doctor?
It pays for the premiums. Yeah. So you can use that for the premiums, and then a lot of times the out-of-pocket costs, an HSA can be a wonderful thing to use for that, because with an HSA you can't use that to pay for the premiums.
Oh my goodness.
Unless you're on COBRA. There's all these little caveats to everything. But.
Wait a minute. Okay, so the HRA, you cannot use that for actual medical expenses, only for your insurance premium?
There are some that you're able to use it for, but the big benefit is that you are allowed to use it for the premiums, which is generally the biggest cost that people have for health insurance. Because if you're paying $800 a month for the health insurance, typically that covers a significant amount of what would otherwise be out-of-pocket expenses.
Right.
And so that's going to be your biggest expense over the course of the year. So that HRA reimbursing you for that, if you have, 20 grand saved up in that, that can cover maybe 2 years of health insurance and maybe close that gap until you hit Medicare
Which
age.
is so sad
Right,
that it
right.
only covers 2 years.
Yeah, exactly.
Okay, so this is something that everybody under the Indiana Public District or employer should have, right?
Not necessarily.
Okay.
Yeah. So the plan with INPRS is very complex.
Okay.
There's a lot of people under it. There's policemen, there's firefighters, there's teachers. I know a lot of the people at Fort Wayne Community Schools have an HRA or have the ability to have an HRA. So it kind of depends on the individual retiree.
Okay.
One of the biggest takeaways, I'd say, from being in the Indiana Public Retirement System is that it's very complex, right? So when people retire, a lot of times they get this giant packet and it's 60 pages and it says, hey, you've got a 403B and a 401A, you've got this universal life policy, you've got this term policy that might be ending, all of these different things. You have a pension, there's a lot of things, a lot of moving pieces, and so trying to understand how they work, chatting with somebody ahead of time to kind of determine that can be really helpful. Because there's a lot of people out there that have an HRA that don't know it. There's a lot of people out there that maybe think they have one and they don't have one, so it can kind of go either way.
Oh my goodness. Well, luckily you broke it down for us today and now it can be top of mind and people should give you a call, especially this summer. As you said, teachers are out.
Yeah.
The perfect time to start having these conversations and to meet up with you.
Exactly.
All right. Well, thank you so much, Caleb.
Yeah, thank you.
And if you'd like more information about Foster Financial, we'll be sure to have their contact information listed below. Give them a call over the summer, and I'll see you after the break. This segment sponsored by Foster Financial. Thank you so much for tuning in today. We hope you enjoyed the show. And remember, you can catch up on episodes and segments of Living Local 15 by going to Wayne.com, downloading the Wayne app, and also checking us out on YouTube. And I'll leave you with this. While you're out, give a little smile, give a little wave, share a little light and love today. And I look forward to seeing you here tomorrow. Bye-bye.